Our eyes are truly remarkable. They are the windows through which we experience the vibrant tapestry of life. They allow us to see the faces of our loved ones, the beauty of a sunset, and the words on a page that transport us to other worlds. As we journey through life, it is natural for our bodies to change, and our eyes are no exception. Sometimes these changes are slow, almost imperceptible. A little blurriness here, a bit of trouble with fine print there. We might dismiss it as a normal part of getting older, a simple sign that it's time for a new pair of reading glasses. But I want to encourage you to think of your vision a little differently. It's a vital sense that deserves our close attention and care. Think about your eyesight as a sensitive barometer of your overall health. Subtle shifts can be early indicators, gentle nudges from your body telling you that something needs a closer look. Blurry or hazy vision is perhaps the most common vision complaint we hear. It's that frustrating experience when objects, both near and far, lose their sharp edges and look as if you're viewing them through a foggy window. One of the most significant conditions associated with blurry vision, especially as we age, is cataracts. Consider the story of Eleanor, a retired teacher who loved to bake for her grandchildren. She started noticing that the measurements in her favorite cookbooks were becoming difficult to decipher. Have you ever found yourself feeling less confident navigating in low-light conditions? Or maybe moving around your own home at night, a place you know like the back of your hand, has become a challenge. Another potential cause is glaucoma, a disease that damages the optic nerve. I remember speaking with a gentleman named Robert, an avid fisherman who loved getting out on the lake before dawn. He told me he started having trouble tying his lures in the dim morning light. Many of us have experienced them at some point, those little specks, squiggly lines, or shadowy shapes that seem to drift aimlessly across our field of vision. If you experience a sudden shower of new floaters, perhaps accompanied by flashes of light, these symptoms can be a warning sign of a serious condition called a retinal tear or retinal detachment. A patient of mine, a vibrant woman named Maria, who is a passionate gardener, shared her frightening experience. Wisely, she did not wait. She called her ophthalmologist's office immediately. Pain is our body's fundamental alarm system, a clear signal that something is wrong. If you experience persistent pain in or around your eye, or a feeling of pressure that doesn't go away, it's important to pay close attention. Eye pain and pressure can be symptoms of several conditions. One of the most serious is acute angle closure glaucoma. Let me tell you about David, an accountant who found himself grappling with daily headaches as tax season approached. A new pair of glasses tailored to his precise needs resolved his headaches within a week. Imagine looking at a single object, like a clock on the wall or a streetlight, and seeing two distinct images instead of one. When double vision occurs because the eyes are not aligned properly, it's called binocular double vision. It can be an indicator of a problem with the muscles that control eye movement, the nerves that send signals to those muscles, or even an issue within the brain itself. A woman I know, a retired librarian named Sarah, experienced this firsthand. Her doctor immediately started her on medication to control her blood pressure, and over the next few weeks, her double vision gradually resolved. Imagine your field of vision as a grand cinema screen. Now, imagine dark curtains slowly closing in from the sides. You might find yourself bumping into furniture more often, or being startled by people or objects that seem to appear out of nowhere from the side. This narrowing of your visual field is a classic and serious sign of glaucoma, one of the leading causes of irreversible blindness worldwide. Consider the case of a gentleman named Frank, a retired bus driver. The test showed that Frank had lost a substantial portion of his peripheral vision in both eyes due to undiagnosed glaucoma. We have journeyed through 7 important warning signs your eyes might send you. Embracing a proactive mindset means making regular comprehensive eye exams a non-negotiable part of your healthcare routine. This is especially true for those over 50, and even more so if you have a family history of eye disease. These exams allow professionals to establish a baseline and detect problems like glaucoma, macular degeneration, and diabetic retinopathy at their most treatable stages. A diet rich in leafy greens like spinach and kale, colorful fruits and vegetables, and fish high in omega-3 fatty acids provides essential nutrients that protect your eyes. Protecting your eyes from the sun's harmful UV rays by wearing sunglasses and a wide-brimmed hat is a simple but effective habit. If you smoke, quitting is one of the single best things you can do for your eyes, as smoking significantly increases the risk of cataracts and macular degeneration. Your vision is precious. It allows you to read to your grandchildren, to drive to visit friends, to pursue your hobbies, and to simply appreciate the beauty around you. Do not hesitate to reach out to an eye care professional if you notice any changes, no matter how small they seem. Your future self will thank you for the care and attention you give your eyes today. If you found this video helpful, hit the like button, subscribe to Ageless Clarity and Wellness, and turn on notifications. Watch our next video. 10 foods that naturally improve your vision after 50. Your eyes will thank you. Catching these signs early can help protect your sight for years to come.